Hi everyone, so I'm going to give you a tour of the Fulton School Dental Hygiene. There's 30 working operating units where the students can see 30 to 60 patients a day depending on where they're at with patients. So we're going to go take a tour of the clinic and then the radiology department where I am. Alright, so in clinic we have the where the instructors are located for the students, and then if you come over here, we're going to show you the view that Fulton has to offer for patients when they're getting their treatment done. It's Seaside Park, right on the Long Island Sound, which is great for patients to really be comfortable. Alright, so working operatories go all the way down. There's a number of them. You can take a tour over here. Over on this side of the clinic you can see University of Bridgeport, Bridgeport City, and their soccer field. Another instructional working area. We're going to go head down to Central Supply and then head down to radiology. This clinic gives you a full spectrum of Cleveland Sound as it goes over here by the ferry. Here's our Central Supply area. It's big, open. This is where all the supplies and sterilization happens. Alright, let's head down to radiology. Radiology is where I've been interning for this semester. So far I've probably put in about 50 or plus hours, close to 60 right now. I come in every Tuesday and work from 12:30 to 6. Here's our resource room where students can look over x-rays, patient charts. There's a phone if they need to call anyone, stuff like that. The materials lab where they can pour up alginates and study models. Here is our panel machine, all digital, equipped with DEXIS. And then this is actually an easy Panorex machine that I like to use. It's very easy for the students to learn, and then there's sagittal plane. So in radiology we have 4 working operatories. Here's one, also equipped with digital. Another one, the third one. And then down here, we usually have a Dexter down here. It must have been busy this afternoon or this morning. Usually this is where I teach the students any problems they're having with x-rays. Most of it is more digital that they're having problems with, so if once they're doing their evaluations on their x-rays, Ms. Verdon will bring them to me and I'll help them out over here. Over here is the developing room where I help develop their x-rays, film duplicating. It's very spacious in here, just for film developing. There's guides for if they're stuck on taking x-rays. Usually they're equipped everywhere with these guides in case they're having difficulties. The V-box here, along with important information for like bisecting technique, the pano, landmarks, stuff like that. And then down here is another resource room where students can look at their x-rays and evaluate them. There's white boxes, and then if they're digital they can look through the computers. And then this is where the radiology sterilization is. This is the clean side, the dirty side. Last week we taught the students how to go through the different process in breaking down and setting up trays, stuff like that, and starting sterilization. So I've been trying to get this stuff organized by making different guidelines for packaging, whereas that's an issue here in clinic. I made these the first week of their clinic. I mean, we're still having issues here, but I'm trying to resolve them and trying to make sure that they're doing it correctly. And then, what else can I show you? Let's see. Office is locked, so I can't show you that. There's also, I'm not going to show you, but there's where all the supplies are at, anything that they need, stuff like that. And we can go to reception if you want. So yeah, this clinic is actually built in 2010, so it's newly renovated. When I was here 2 years ago, it was only 2 years old. Some history on the clinic was in 1913, Irene Newman was the first dental hygienist to graduate at Phones, and I was the 100th class to graduate in 2014. So that was very cool for me, as I'm the 100th class to graduate. So let's go show you the reception area. Hi everyone, so I'm going to give you a quick preview of the reception area here at Phone School Dental Hygiene, where the patients come in and check in for students for them to be seen, along with making appointments. So here is where usually the receptionist is and some of the assistants that help her out. Here is pretty much the large reception area that we have at Phones. If you come over here, we have a 1913 replica of the Phone School Dental Hygiene. And some of their stuff that they used. Here's some history of the Phones Clinic donor wall. And then over here is the class of 1913, sorry. And then in here is a display case of the different dental tools that they used back at Phone School Dental Hygiene back then. It's great to show the patients how far dentistry has really evolved. Last year, my group and I were in strategies class, and we made a poster board on seek and relief of temporal mandibular disorders. It's actually located in the Phone School Dental Hygiene, where all our patients can view these poster boards. There's a number of them throughout the clinic. Here's one on lip and cleft palate and dental hygiene considerations. And then down here, just more. They're located throughout the clinic. They're just more for informational strategies to teaching our patients if they're walking around, to teach them more about dental hygiene. Thank you everyone. I hope you enjoyed the site at the University of Bridgeport Phone School Dental Hygiene.